Welcome, class, to Chapter 8 Blood Collection Equipment for Venipuncture and Capillary Specimen lecture. As you know, that the primary duty of a phlebotomist is to collect blood samples for laboratory testing. Blood is collected by several different methods, including arterial punctures, capillary punctures, and venipunctures. Healthcare workers use several different types of supplies and safety equipment in the collection of blood and its transportation to the specimen's processing center. The blood collection equipment is used for venipunctures, or blood collection from the vein, skin puncture, blood collected from a finger or infantile or arterial puncture. Venipuncture equipment includes such things as vacuum tubes, or evacuated tubes as it's sometimes called, safety needle collections that allow the blood collector to collect the patient's blood, plus a tourniquet to assist in locating a vein, supplies to cleanse the puncture site, labeling supplies, gloves, and special tray for transportation of the blood specimen. Evacuated tubes are the types of tubes used with both the ETS and the syringe method of obtaining blood specimens. With the syringe method, blood is collected in a syringe and must be immediately transferred into the tube. Venipunctures with vacuum or evacuated tube system is the most direct and effective method for obtaining a blood specimen. Evacuated tubes come in various sizes and volumes ranging from 1.8 to 15 milliliters. The evacuated tube system requires an evacuated sample tube, the double-pointed needle, and a special safety plastic holder or adapter with an attached needle cover that is used to cover the needle after blood collection. Tube selection is based on the age of the patient, the amount of blood needed for the test, and the size and condition of the patient's vein. Tubes are available in plastic as well as glass. For safety reasons, though, most tubes are recommended in plastic now. There are very few glass tubes that are still left available to be used. A tube holder or adapter is a clear plastic disposable cylinder with a small thread opening on one end, often called a hub, where the needle is screwed into it, and a large opening on the other end where the collection tube may be placed. Holders are typically available in several sizes to accommodate different size tubes, including special sizes for large um, diameter blood culture bottles, some of which have adapters inserted to narrow the diameter of the holder and allow collection of evacuated tubes after blood collection specimens have been collected. Holders are available with or without safety features. Safety features include shields that cover the needle and devices that manually or automatically retract the needle into the holder either before or after it is removed from the vein. So some manufacturers have developed both active and passive needle shielding devices. The active devices require the blood collector to actively cover the needle with the safety device. Therefore, the passive needle shielding device shields the needle automatically after blood collection. So what we use in the lab is an actively cover. We actively have to cover the needle once we finish doing a lab draw. And some fancier office has the type of needle as soon as you withdraw the needle out of the patient arms, it automatically retracts on its own by the click of a button. Blood collection tubes and additives. Blood collection tubes are available in different sizes and in a safety engineered plastic to reduce risk of tube breakage or blood spillage. The plastic tubes have a silica coat inside or other activating substance for clotting to start in the tube and to go to completion. Glass collection tubes are not desirable because of the risk of exposure to bloodborne pathogens, which are disease-causing organisms, is increased due to possible breakage. The only tube that is really still glass that you might still use in the lab is the ACD tube in the SPS tube. For whatever reason there is, those are the only two tubes that still come in a glass case. I don't know if it's because of the additive in it or what, but that is the only one that still comes as a glass tube that is still used in the lab. The external tube diameter and length plus maximum amount of specimen to be collected into the vacuum tube. There are two criteria used to describe vacuum tube size. The first one is the smaller size are useful for pediatric and geriatric collection and can be purchased with different types of additives, some being anticoagulants. Most manufacturers use these color coded according to um, clinical laboratory standards. As you know, you have your light blue, your red, your green, pink, purple, tan, orange, royal blue, so on and so forth. Many tubes are specifically designed to be used directly with chemistry, hematology, or microbiology instrumentation. So you have different additives that are also included into these tubes. You have your anticoagulants and preservatives. Your anticoagulants often contain preservatives that can extend the metabolism or the lifespan of a red blood cell after blood collection has been done. You have your acid citrate dextrose or your ACD. This is a solution that is available in two formation solutions. You have solution A and you have solution B. And this is used for immunohematology testing, such as DNA testing and human leukocyte angia or HLA, phenotyping used in parental evaluation and determine transplant compatibility. Usually, a lot of transplant patients get ACD tubes drawn on to see if they can find someone who is a compatible match to them to get a transplant. The ACD preservative um, coagulation by binding calcium with little effect on cells and platelets. ACD tubes are yellow tops and require 8 inversions as soon as collection is done. Then you have your light blue tubes. Your light blue top tube contains sodium citrate, and this is used in many coagulation procedures such as PT, APT, PTT, which are done on blood collections in light blue top vacuumators. Light blue, light blue tops must be drawn correctly You cannot overfill it or underfill it because it will give you erroneous results. So usually a light blue top, and I say it stops on its own, which it really does. When it's full, it'll pretty much stop pulling blood once it fills up. So there's really not a high risk of overfilling or underfilling. Sometimes you run into that problem if your tube is just about to expire. Then it has a tendency to overfill because, as you know, once your tube starts to expire, it loses its vacuum capability, and that's when you run into overfilling or underfilling problems, is due to your light blue top being expired. And that's what a light blue top looks like. Now, sometimes you'd be called just blue. Some labs will just say, I need a blue top. And usually that's what they're referring to, is the light blue top. Due to the fact that different manufacturers may call it different things. Some manufacturers, it really does look like a light blue top. And in some manufacturers, it looks more blue. So they'll say blue or light blue. Right. The next tube we're going to talk about is our SST tubes, or our serum separating tubes. These tubes can come in multicolors. It'll come as a multi-top, or we'll say a multi-top, or a gold top, or we'll say a tiger stripe, multi or tiger stripe. And it'll also come in a gold top, and then sometimes it'll come in a red top with a gold center in the middle. Serum separating tubes, they are sometimes called a clot activator serum tube. These tubes contain what we call a polymer barrier that is present in the bottom of the tube. Once blood has clotted, then it's centrifuged, and what it does, the polymer pops up, and it separates the fibrin and cells from the serum. So you have the serum at the top and all the rest of the whole blood at the bottom of your tube, and it's divided by the polymer. Usually these tests are done. This particular tube is used for therapeutic drug monitoring, your chemistry testing. Sometimes it's used for immunohematology testing, just depends on what it is. It's also used to check electrolytes and other tests. Right. The next two we'll talk about, which you hardly ever see at all, and I've been to just about every hospital here in Lafayette, is the orange top, or the gray, yellow tiger top, or multi-top, as they say, or speckle top. What this tube is used for stat labs and stat lab situations, due to the fact that there's no clotting time. With an SST tube, you have to wait at least 3 to 5 minutes before it starts to clot on its own. With this, you have to wait less than 5 minutes before it clots. It pretty much starts clotting as soon as you finish inverting it. It'll start to clot. That way you can centrifuge it faster and results can go out faster. Especially in emergency situations, you really want those results to go out fast because you want to know what's going on with the patient. Next is your red top tube. Your red top tube has nothing in it. It is additive free. There's no additive whatsoever in it. Now, it can come, um, yeah, your red top tubes have no additive. It has no polymer at the bottom. It's just solid red. We usually call these tubes our waste tubes, but it's not really a waste tube because you can run chemistry testing off of it and use it as well as that, or you can run infectious disease testing off of it. The only bad thing is once you centrifuge it, you have to pipe pipette out the serum, because one little jostle or one little shake, the serum and the whole blood mixes back together again, because there's nothing separating the two. Right. And we're back to orange top tube. Why are we back to orange top tube? All right. Orange top tube has a thiamine-based activator with gel for separation. Oh, it just didn't keep them together, I guess. This slide, I'm gonna have to fix that. As we know, orange top tubes are used for stat situations. It has the additive it has thiamine in it, but it has also a cell, a polymer at the bottom of it, and it clots less than 5 minutes. All right, the next one we have is our clear top tube, or our white top tube, or red with light gray tiger top is what it is. And basically, this is another type of waste tube because it doesn't have any additives in it. Also, you can also run chemistry testing on this type of tube too. Some labs do have white tube tops or clear. Some do. And we say clear, but it's clear with a red barrier in it. But for the most part, it is clear. Okay. Next is your green top tube, which is also known as your plasma separation tube, or your PST. You have your light green. You have two different green tops. You have your light green and you have your dark green top with two different additives in them. It can either contain sodium heparin, ammonium heparin, or lithium heparin. The most two common ones you'll see in the hospital or on your drawers is your sodium heparin and your lithium heparin. Ammonium heparin is usually a special order test, something we have to special order that tube for because it's not kept in the lab because it's hardly ever used. These are any blood tests that have to have plasma instead of whole blood, or whole blood tests. Where most tests are done in an SST tube, every once in a while a doctor may want whole blood or plasma specimen, which we would draw in a green top, but they have to specify that if they want serum or they want whole blood. With green top tubes, we can do microslides with them because it doesn't have, due to the heparin, it won't clot as fast as if it was in an SST tube. And another thing, we can run off of a green top tube. If it's a lithium heparin, we can do glucose testing, bun testing, ionized calcium, creatinine, and electrolyte studies. If it's a sodium heparin, we can do coagulation testing on it. BD Vacutainer Baricon tubes use mechanical separators that reduce centrifusion time from 10 to 3 minutes and reduce cellular concentration of 50 to 65% compared to any other current plasma gel tubes. Mechanical separators used to absorb hydrophilic drugs, such as for use for therapeutic drug testing. The next tube we'll talk about is our purple top tube, which contains EDTA. These are used for hematological testing, such as CBCs, WBCs, RBCs, diff, platelet counts, hemocrats, hemoglobin, or usually we call H&H, which is your hemocrat and hemoglobin levels. Your A1C levels can also be done on a purple top. And some hospitals also use the purple top to do blood banking processes also. Your pink top is almost the same as your purple top, but it can only be used for blood bank collections only. It also contains EDTA in it also. You very seldom see pink top tubes because, like I said, it does pretty much the same. Why spend money on a pink top tube that only is used for blood bank when you can order purple tops that does the same thing? Your gray top tubes have an additive. They usually contain potassium oxalate or sodium fluoride. And sometimes you'll see the tube also says potassium oxalate, sodium fluoride on the same tube at the same time. These are used for glycolytic inhibition tests, such as glucose testing. Gray top tubes also can be used for alcohol testing. Also, gray top tubes can be used to check for if a patient has any lactose intolerance behavior. Your royal blue top, or is sometimes called dark blue because it is a dark blue. Some are starting to get away from royal blue and starting to say navy blue. Sorry, navy blue. They're getting away from royal blue to navy blue because if you look at the tube, it is a darker blue than royal blue. So they're starting to say navy blue as far as the royal blue top. And the royal blue top is usually drawn for nutritional studies and toxicologies. It's also used to do test trace elements, your heavy metals, such as your mercury, your zinc, your arsenic, your heavier metals. Tan top tube is used for lead testing, and it contains EDTA. Now, can you draw a royal blue for lead testing? Yes, you can, because it is considered still a heavy metal. But if your hospital or lab that you're working at has tan top tubes and the patient needs a lead test, then we will draw it in that tan top tube. If it doesn't, we can also draw lead in a royal blue, being that it is still considered a heavy metal. Black top tubes are specialty tubes that sometimes we have to draw on patients, especially if they have to recheck their sedimentation rate or their ESR. These are special order tubes that go to a special laboratory to get tested. This is just to test the patient's erythrocyte levels to see why their blood is not clotting the way it's supposed to be clotting. Molecular diagnostic tubes. These are special sterile vacuum tubes for molecular diagnostic studies and are available containing different additives such as sodium citrate, sodium heparin, EDTA, and are required for different test procedure. These particular tubes come in a little Ziploc bag, in a little baggie, and you would get a red, a purple, and a blue top, I believe. And it's 3 little tubes we have to collect, and those are for molecular diagnostic studies. And they're already pre-bagged and set for you to draw from. Okay. Tube organizers are TIMOs, tube management organizers, is an inventive test tube holder that assists with managing the test tubes during blood sample collections. Now, the hospital doesn't really supply these. If you want to acquire one of those to kind of help you with your draws so you don't have to hold your tubes in your hand as you're collecting them, you can put them on this holder. But the only drawback with it is you will not be able to carry it in an infectious control area, because then you would have to sanitize it after each patient's use every time you would use it. So it has its drawbacks. It's good to have if you don't want to hold your tubes in your hand, but it's bad to have because after every patient, you gotta sit there and disinfect the holder each time you use it. Safety syringes. Some patient veins are too fragile for blood collection with vacuum tubes because they are very thin and very fragile. You find that a lot in your jerrys. We really don't use it on babies either. Um, we use a smaller needle or a safety syringe. Different ones we have is the safety butterfly needle collection set, or the butterfly as we like to call it. The reason why we don't like to use syringes as often as we should is because of the hazards that it poses. You have a higher increase of accidental needle stick due to the syringe because there's really no safety cap on it to prevent you from getting stuck. All right, sometimes use of collecting blood from central venous catheters or central lines, as we say. We really can't draw from those. Nurses can only draw from art lines or central lines. They're good for when patients have little to no veins at all. But like I said, we cannot draw from them directly, so we would have to transfer it using a transfer device from the syringe needle to the tube. So the major parts of a syringe are the needle, is the safety cover, the hub, the barrel, and the plunger. Those are all the parts of a syringe. As you can see from figure 812, the plunger is at the end. You have your barrel, which has your numeric measures, anywhere from 5 cc's to 20 cc's or milliliters. Depends on how the needle is made, how the metric system is named on the barrel. Then you have your hub, which is where your needle attaches into. And then you have your safety shield for the needle, the shaft, and then you have your lumen. A safety syringe shield transfer. Oh, I'm sorry, I'm going too fast. A syringe needle should be shielded after blood collection removal and discarded in the sharps as soon as you finish with it. Never ever recap your needles is what you're supposed to do. But if you're transferring from a syringe to your tube, you have to recap. But we don't recap by holding the cap in our hand. We slide it on and push down from the table or wherever we're working from. And then we remove the needle from there so we can put our transfer device onto the syringe itself, which is what it's talking about here. That once we acquire the blood from the syringe, we have to put or attach a transfer device onto the syringe in order to place into the tube bag containers. And if you look at figure 814, that gives you a picture of a transfer tube, and we do have transfer devices in our lab, and we do teach y'all how to use those. Right. Safety needles and holders. As you know, the gauge and length of a needle used on a syringe or a vacuum tube is selected according to the specific task. The gauge number indicates the diameter of the needle. The smaller the number, the bigger the needle. The larger the number, the smaller the needle. That's a little rhyme that you have to kind of remember, that the the smaller the number, the bigger the shaft of the needle is. The larger the number, the smaller the shaft of the needle is. Needles are available in either 1 or 1.5 inch long. Needles attached to the safety holder or adapter or syringe at its hub. Needles are sterilized and packaged by vendors in sealed shields that maintain sterility. The BD Eclipse shield is active immediately after the blood collection tubes are filled and the needle is removed from the vein. When the thumb presses forward on the shield and you hear an audible click, that indicates that the safety shield is locked in place. So therefore, we cannot unsafety it to reuse the needle or get stuck with the needle. All right. Always check visibly for any needle damage. A blunt or bent tip can be um, blunt or tip Blunt or bent tip can be very harmful to a patient. It can cause more damage and more harm to the patient and cause excessive pain. So it's always good to double check your needles before you insert or before you draw on a patient. A multi-sample needle is used with Vacutainer collection tubes and the holder to allow for multiple tube changes without blood leakage within the plastic holder. The multiple sample needles have a plastic cover over the tube top puncturing portion of the needle. This cover creates a leakage barrier. Right. Then you have your S monovent blood collection system. This is an enclosed multi-sampling blood collection system which allows you to collect blood using either aspiration or vacuum principles of collection. Each needle has integrated holder that does not require assembling before use and cannot be disassembled, meaning it's all together, meaning the needle and the holder come together. You can't assemble it or reassemble it. The ones we have to assemble. These, the S monovent blood collection system, they come already with the needle, the holder, everything all together already. Right. Butterfly needles or blood collection sets are safety wing infusion sets, as they're known by different names. Most people know them as butterflies. Every patient in the world knows what butterfly is. Even if they don't know how to speak English very good, they know what butterfly is. And the reason why most patients love butterflies is because it's a smaller needle, it's a shorter needle, and they say it doesn't hurt as much as a regular venipuncture needle. With a wing infusion collection set or butterfly, it is an indisposable tool for collecting blood from small or difficult veins, such as hand veins and veins of elderly and pediatric patients, as it allows for more flexibility and precision than a needle and syringe, or just a regular Vacutainer needle. It is most commonly used intravenous device. It is stainless steel beveled needle and tube, usually 5 to 12 inches long, with attached plastic wings on one end and a fitting for a multi-sampler adapter, excuse me, or fitting for a syringe attached to the other end. The most common butterfly needle size are 21 and 23 gauge, and the length of these needles range from 1/2 to 3/4 inches long. The butterfly needle is sometimes used in the collection of blood from patients who are difficult to stick by conventional methods, such as geriatric patients, cancer patients, being that they're going through radiation or chemo, and of course, pediatric patients, due to the fact that P tablet B veins. Butterfly needles are required to contain safety devices according to OSHA regulation to reduce the possibility of incidental needle sticks. Butterfly safety device includes locking shields that slide over the needle, blunting devices, and needle retracting devices. The system includes multi-sample needle-shaped tube holders and sets for use in collecting blood specimens directly into the blood collection tube and blood culture bottles, as well as multi-sample needle shield transfer tube holders and sets for transferring blood from syringe into collection tubes and blood culture bottles. And the most popular one, you have the BD Vacutainer Ultra Touch Push Button Blood Collection Set, or Butterfly. This is one of those techniques where a push button will retract the needle as soon as you pull it out the patient's hand. There's two buttons on the side you press, and the needle sinks back into the adapter itself without us having to put a safety guard on it. All right. This concludes Chapter 8, Lecture 1. On tomorrow, we will go through the rest of Chapter 8. If you have any questions about what we covered so far, please feel free to text or message me through Edmodo, and I'll be glad to answer any questions. I thank you and have a nice day. Bye-bye.